Welcome, everybody. This is Darlene Cavalier from SciStarter, and very proud to be hosting the Crowd and Clouds Google Hangout. This is a live broadcast, so as a reminder, anything could happen here, so bear with us, but hopefully it's a seamless show. Today I'm joined by three very impressive guests. We have Veronica Combs from the Institute for Healthy Air, Water, and Soil, and Hi, Veronica. And Melissa Williams and Meredith Barrett from Propeller Health. This is a new citizen science effort that we are going to discuss throughout the program. So I'm catching some feedback there. Hopefully it's not that painful for our listeners. Len, do you recommend that somebody goes on mute, or is this okay for the audience? Okay. So let's get started. Veronica, I'm actually going to jump in with some questions for you related to asthma, because that's really what we're going to be talking about here is the real combination of the crowd and the cloud, working with the crowd, in particular people who suffer from asthma, and using some really cool sensors and some mobile devices, of course, otherwise known as your phone. If I'm mistaken, and I could be, so you're going to just have to correct me on that one, and then coupling that with real efforts to improve the health of a city and improve the way that we can diagnose and treat asthma as well. So starting with you, the city's Chief Innovation Officer, Ted Smith, was not able to join us today, says that the city has been on some pretty, I guess, impressive lists, not a ranking that you really want, and this is Louisville that we're talking about, including in 2014 being listed as the #1 spring allergy site in the United States. So things have gotten slightly better. I see that you've dropped to #4.
Yes, we have.
But really curious to know what's causing this and why the high ranking, and then what can be attributed to the slightly lower ranking that you have now.
Thank you for having me. Louisville is on the river, and we're surrounded by hills. So all the bad air and all the pollen and all the pollution sort of gathers and holds over our city. So that's on a bad air day. In general, we have what's called the Ohio River Valley crud, and people with sensitive airways, or even people who lived here for their whole lives, have a lot of breathing disorders. The Kentucky Derby was just last weekend, and it's a great time of year, and everyone is celebrating and drinking mint juleps, but you have to have your allergy meds and your tissues ready because there's a lot of pollen in the air. So this year, surprisingly, there was less pollen than was predicted, and so that helped us drop a little bit. But at the same time, we still used a lot of over-the-counter meds for allergies and asthma and things like that. So it's just a really dynamic list. Some cities that were on the #20 jumped up this year. Our friends at the Asthma and Allergy Foundation of America always say that the goal is not to move, the goal is to make the best of where you're living, because there's allergies and asthma everywhere. But Louisville, we're just tired of being defined by our geography, so we partnered with Propeller Health to work on this new approach to asthma. And the idea is to connect the outdoor conditions to asthma attacks and try to understand that connection better and help people understand if they're sensitive to pollution, or if they're sensitive to fall pollen or spring pollen or whatever their personal triggers are. So this program helps individuals, but it also helps the city understand which neighborhoods have the highest burden of asthma. So instead of planting trees all over the city, because trees help reduce the effect of asthma, maybe we'll plant trees just in the neighborhoods with the biggest burden. So the geographic data from the Propeller Center opens up a whole new world of possibilities for us.
Well, there's our whole show, folks. That was it. That was amazing, Veronica. Just to ask a couple more questions about the asthma health, and I'm going to move over to Propeller too. We kind of have an understanding of the physical and the health cost of asthma on an individual. I want to talk about how that translates into a city's economic risks, and then what that does to a city on a whole. But if you can talk a little bit about that from the asthma standpoint.
I talked to one person who said, my wife and I visited 3 times before we moved here. He visited in spring, summer, and fall because he had very bad allergies and he wanted to see what the air would do to him. I talked to a woman last weekend who said, we moved here from New York, and as soon as my kid is done with high school, we're leaving because I have to stay indoors year-round. So it's just some people are more sensitive to it and just have to find different ways of coping. So again, we can't change the hills that hold the pollution in around our city, but we can, perhaps work on traffic congestion or plant more trees or work with emitters. We've chosen to work with employers who pay their own healthcare costs. They're called at-risk employers. They're very motivated to manage their healthcare costs. So if this new approach to asthma can help improve a person's quality of life and reduce healthcare costs for the individual and the employer, we think that that's the key to making this sustainable and changing the way asthma is treated in Louisville.
Yes, great, and a wonderful transition over to some questions that I have for Melissa or Meredith, whoever would like to field this. But we heard a little bit from Veronica about what this means to a city, to have your citizens kind of not feeling great and not wanting to visit and possibly thinking about moving because of this. Veronica touched a little bit about the typical, or I guess ideal, customer or client of your product that I want you to explain a little bit more about. And here we get into the behavior changes that we're starting to see with your sensor and how this can start to improve a person's health, how they respond. So it's even more than just thinking about planning and where you're putting trees or how the city can plan around where the air quality isn't great. It seems like your tool and your sensor has been pretty effective about, and that you have quantified this too, in terms of changing behaviors of people who suffer from asthma. Can one of the two of you talk about that a bit?
Yeah, I'd be happy to talk about that. Of course, I get to speak with patients almost on a daily basis. I'm the lead clinical educator, so I do a lot of outreach to patients in the program. And the program is really for anyone that wants to better understand asthma and help self-manage their disease. So it can be someone who just suffers from asthma, maybe seasonally as mild asthma, or somebody that is really struggling daily to get their asthma under control. So it's really a little bit for everyone. And what we found is that once they see the data, and the great thing about it is that we're able to capture this passively. There's no work involved for them. They use the sensor. There's no more asking them to write stuff down in a diary, figure out where they're at, when it happened, and then try to put all that information together 6 months later. Now we're able to do that for them, and we can figure out trends, times of day that they need their inhaler, days of the week. Location is really important. We found for some patients that they figured out, gosh, what's going on every Wednesday I use my inhaler. I can't understand what's different. And a patient actually said, that's funny. My girlfriends and I go to this park and walk every Wednesday. And she did a little research and found that right next to the park there was a horse farm. And she did know that she was highly allergic to horses. And so by just figuring that little thing out and moving locations, we were able to kind of get rid of that altogether. So it really promotes behavior change. They're able to see what's normal, what's not. We can redefine what normal is for them, and then really promote physician-patient relationships as well.
So maybe while we're talking about
I'm so sorry that I just put myself on mute. So what I was saying was I was asking Meredith to give a little description of how this all works. I think you may have a prop there. If we don't, we can put one on screen. And then also if you could tell us how the company started and when.
Sure, absolutely. Great, thank you. And thanks, Melissa, for really helping us sort of ground what we're talking about by putting it in the patient's perspective. Propeller Health is a digital health platform which is dedicated to improving the day-to-day self-management of respiratory disease, so diseases like asthma and chronic obstructive pulmonary disease. And as Melissa talked about, we're really aimed at helping to have patients improve their outcomes and really improve their quality of life. And ultimately, we want to reduce emergency department visits, reduce hospitalizations, and costs as well. The company was founded in 2010 by David Van Sickle, who's our CEO. He has a really interesting background, medical anthropologist. He worked for the Centers for Disease Control and just had studied asthma in the US and abroad for almost 2 decades, and just really became very frustrated with the sort of lack of progress of really bending the curve on asthma. So asthma prevalence and morbidity have continued to rise over the past 20 years or so. Even though we have all this money and all these great medicines out there, we're still seeing it really impacting people's lives and costing quite a lot of money. And so he thought that being able to develop a sensor like this one here that Propeller has developed would be able to capture the time and the place, both the where and the when of when people experience asthma symptoms and have to use their inhaler. Asthma is really unique in that it's very environmentally aggravated. So, and each person is different in what they're sensitive to. And so, having this type of data that in real time and in real space really improves upon what we've had in the past. So, public health research has had to rely on aggregated data, at the county level or just prevalence data, but we didn't really know where and when people were having asthma symptoms. So this really takes us to the next level. What we do is so the sensor, when a patient uses their inhaler, we capture the date and the time and the number of puffs taken. And then that information, it's a Bluetooth-enabled sensor, and so that information is transmitted to a smartphone where we're able to grab a GPS location. So then we know where and when the inhaler was used. And then that information is then transmitted to Propeller's secure servers, where we do a lot of analytics on the back end, and we provide all of this information back to the individual patient so they can help understand what's going on with their disease, see their trends, better understand their own individual triggers, and then we also help promote their adherence to daily controller medications. And then we also can share that information with their doctor, so the patient and the doctor can have a much more informed conversation about how well the patient is doing, whether there needs to be some medication changes or not, other ways to improve their day-to-day experience with their disease. And I think what's, ultimately our goal is to improve outcomes for patients, to help them live their lives without being limited by their asthma, improving their quality of life. We're really looking to ultimately reduce those costly ED visits and hospitalizations as well as cost. And I think Air Louisville is a great example of sort of taking all of that to the next level and also being able to help the city and the community identify where the heaviest burden of asthma is across the county.
It's a great description. Thank you for that. And speaking of taking things to the next level, too, you're in Louisville now. You have a couple of other pilot cities out there, is that right? And are you planning to go national or global?
We do. So we've been really excited about Air Louisville. It has been the most incredible place to really start these efforts. We've had fantastic partnerships in Louisville, deep partnerships with the city, with the Institute for Healthy Air, Water, and Soils, with a number of different agencies, as well as with really key stakeholders, like Veronica mentioned, with employers and health plans who are in the area and really have a vested interest in keeping their employees and their members healthier. So we are definitely looking to sort of take this model, which has been really successful, and thinking about how we can apply it nationwide. And so we do have a number of cities in the mix. We're looking at cities that have a heavy asthma burden, like Louisville, that really has the the champions within the local government that we've definitely experienced with Mayor Greg Fisher, with Ted Smith in the Office of Civic Innovation, with our partners at the Public Health Department, as well as in the Air Quality or Air Pollution Control District. So really great partners. We're looking for other places that have those partnerships as well. And what we're looking to do is be able to collect more and more of this real-time data on asthma to help develop a national asthma risk map. We currently have rescue inhaler use data collected in every single state in the United States, and we're looking to get more and more of that in every state. And with that data, we can build these really complicated statistical models that help identify where we see the heaviest burden across the U.S., and where that burden might get worse with climate change and temperature and pollen and seasons changing. So it helps us plan for the future too. And so I do want to mention that Air Louisville, we'd love to have more participation in Louisville. So if you're interested, please visit our website. We have a Facebook group. You can sign up, get in touch, get involved. And then we also have a TRI program across the United States too. So if people are out there listening from other regions and want to get involved, we have a chance to also be a part of this and really be a citizen scientist in your own region. So definitely visit Propeller's website and find out more about how to do that too.
That's great, and I'm getting a reminder from our producer here to use the hashtag CrowdCloudLive to send any questions to us via Twitter, and then we will address those questions in just a few minutes. And this is for anybody who wants to take this. I love that this is a public-private partnership. That takes some element of risk to feel comfortable with that type of collaboration. Just working with a private company. So I'm curious to understand a little bit more about the move behind becoming private instead of a nonprofit, or sticking with just academia, and not just academia, but it takes some courage to go out as a startup and make this happen. And it also takes some courage on behalf of a city and some of the universities to work with a for-profit organization. And I'm curious to know if anybody wants to address, like, was that an issue, or am I just making that up?
I'd be glad to address that. I think this was the really the best part of the initial vision for this project. Meredith wrote the grant and submitted it to the Robert Wood Johnson Foundation, and they funded it and gave the grant to the Institute to implement this. And it was just a great entree into all these conversations, because we all live here. We all know that there's the river, and there's the summer haze, and there's the hills, and we are all familiar with the Ohio River Valley crud. So it just opened a lot of doors that may not have been quite so easy if it were just a public company or a startup or even a public health conversation. We brought together 7 employers, including Papa John's and Brown-Forman. We have Passport Health is participating. We have a couple other providers in town. So the sense of place was a great organizing principle. Everyone got it, right? We all live here. We all breathe the same air. So I think it made it easier to build the broad collaboration that we have.
Great. Couple more questions here. If you don't have asthma, are you working on other health conditions? Are there other ways that people can get involved?
Well, at the Institute, we actually just are getting ready to announce a project called the Green Screen, and we found a school on a very busy road, and the idea is to measure air pollution levels for everyone, right, all the children, not just the kids with asthma, and then plant sort of a barrier of trees and shrubs and evergreens, and then measure the air quality again. And it's a Catholic middle school, and as you mentioned before, they're willing to take a risk and do something a little different. So we're going to have lots of little young citizen scientists helping us out with this project. So the idea is to change the environment to make it healthier and to filter out some of this bad pollution. So
okay, great timing for that, because we do have a question from folks on Twitter, and one has to do with young people and children, and this is about kids with asthma, and wondering if the science or the technology is presented any differently if kids want to get involved in this. You might have privacy. You may have a different user interface. Different.
Well, as Meredith mentioned, the science behind calculation is very complicated. Melissa, you've worked with some children, I think, in the program. Would you want to speak to that?
Sure. Yeah, the technology is pretty much the same. So everything kind of follows standard asthma guidelines, but it's actually been really exciting for children because parents can feel safe knowing that they're really going to know, like, when their children are using their inhalers. They get the alerts. They know when meds have been taken, or more importantly, kind of when they haven't been taken. It also gives parents of, kids that are transitioning to be a little bit older. We can give them some responsibility of kind of taking their own meds and handling that themselves, but without the fear of, oh goodness, are they going to forget and then something bad happen, have an asthma attack. So we give them a little bit of freedom, yet we kind of know what's happening behind the scenes as well. So it's been a real, it's kind of a stress relief for parents as well.
I really hate when I do that. Sorry about that. A couple more questions from Twitter here. One being, have you looked at the new World Health Organization data on air quality? And if so, are there any surprises in that data? Anybody feel comfortable taking that one?
I don't think there's any surprises. I think it just emphasizes the need for cities to take this sort of different approach, because whether it's London or Mexico City or Beijing or Louisville, I mean, urban air pollution is a serious health issue. And so to have a company like Propeller and a group like the Robert Wood Johnson Foundation support an innovative approach like that, it just makes even more sense for other cities to try something similar.
And speaking of other cities, we have another question here about Southern California. Any plans to move into Southern California? Any interest in working with people there?
Absolutely. So Propeller has a base in California as well, so we have a vested interest for the air that we breathe in California too. We have a number of commercial programs already going in Southern California, and we are definitely interested in expanding there too, and have been chatting with some folks there as well. So absolutely.
Meredith, can you expand a little bit on the commercial partnerships that you have? Because all of us who have received grants in the past know that you can't necessarily live on grants forever. So while it's great that the Robert Wood Johnson Foundation has supported this and really given it a good kickstart, how do you intend to commercialize this and remain sustainable?
Absolutely. So we for our commercial partnerships, we work with organizations that have a vested interest in keeping their patients or their members or their employees healthy, and with better quality of life, but less expensive care, and really the ultimate goal being to try to avoid those costly emergency department visits and hospitalization. So we work with a number of different partners across the U.S., ACOs, health systems, health plans, and I would say that in Louisville especially, that's where we sort of see the entire microcosm of all the different potential partners that could play into this really represented. So as Veronica mentioned, we have self-insured employers who are at risk and really looking to keep their employees healthy, keep their employees at work and not needing to miss days of work for either their own asthma or their child's asthma. So it really helps to save costs there. We're also with health plans, so looking again to avoid those costly events. And then by doing more of a community effort, by improving air quality in the general community, it also just sort of is able to raise the quality of life for everybody in the community as well. So it has longer reaching and wider reaching, more broad impacts. But I would say that Air Louisville is a great example of how many different partners, commercial partners, can come to the table and really help us. What I've been so excited about in Air Louisville is this opportunity to kind of develop a new collective model of financing community health work. So bringing all of these stakeholders to the table who all have a different interest, but when we put it all together, we sort of have a win-win-win-win for patients, for providers, for health systems, for employers, and for the city.
And so the paying customer would be the healthcare provider, and so it's not necessarily the actual citizen scientist. Is that right? They actually get their sensor for free as well?
That's correct. So far in Air Louisville, our participants have been able to participate for free. So the and the Robert Wood Johnson Foundation has been very generous in helping to fund this work in Louisville. But moving forward after the grant funding, we would really be looking to some of those vested interests, again, the stakeholders like the self-insured employers and the health plans, to see value in this and see a return on investment enough so that they would want to continue participation.
Great. Question here for Melissa. Another one from Twitter. How much of a game changer is this crowdsourcing of digital health information?
Well, speaking from like a respiratory therapist standpoint, it's a complete game changer. We've never had the ability before to be really proactive in our care when it came to asthma. You know, everything was after the fact. We see you after you're in the ER, after you've had an exacerbation. We've never been able to be proactive. So now we have this dashboard that physicians can look at their patients and they can predict when an asthma exacerbation is going to occur, and call the patients, be proactive, send alerts so patients know to take meds, or call physicians. In terms of a healthcare respiratory therapist, it's a complete game changer.
Okay, and so on that note, we're winding down. I guess we have about 5 more minutes, but I am curious to know if you have a testimonial or a personal favorite story you'd like to share in terms of somebody in Louisville who had asthma, so a patient who is using this sensor, and how life improved for that person. Anybody?
I actually do. I have a lot of great stories, but one story that sticks to in my mind more than any is, and I've told this story before, but it's the story of a grandmother who very recently gained custody of her grandson who happened to have pretty severe asthma. And when I happened to reach out to her, she was almost in tears. She was so scared that she was going to do something wrong. She was going to not write something down. She was going to miss something, not give the physician the correct information, miss a dose of med. And we talked about what the sensor could do and the app, and she was literally in tears at the end of the conversation, just to say what a complete relief this was. Just one less thing she had to worry about, and how much she could learn in such a short period of time. And just the security that she felt just having this and being able to share it with the physician. And she it was just amazing at the end of the conversation just to know what a difference it made for one person.
Go ahead. I was going to add that you can absolutely see the great potential here, because all those other types of citizen science projects that are out there monitoring the environmental health of our planet, it's not a far stretch to imagine how that data that is starting to be aggregated and shared and made discoverable can be used, looking at those patterns as both a preventative measure to warn people that if they have asthma, and you're seeing in Louisville certain triggers that are setting off asthma attacks, that if they're in these regions that have similar indicators around the world, to just beware a bit. So I want to say thank you for everybody, and I want to remind the audience that we'll be holding 2 more Hangouts on air quality, focusing on community activism through citizen science and public policy, and how citizen science can really benefit from these types of approaches as well. So good evening, thank you for joining us, and on behalf of Crowd and Cloud, I'm Darlene Cavalier. Thank you.
Good night.
Good night.